For many elderly patients managing frailty or with multiple chronic conditions, leaving the hospital can mean entering the white space when they are back at home without any direct monitoring by a healthcare system or provider. Whether they are one of the 57% who leave the hospital with no direct monitoring or after home healthcare services end, their condition can quickly deteriorate, potentially landing them back in the hospital. What if there was a way to predict who was at risk for emergency room transport before another hospital admission? Introducing CareSage, a predictive analytics engine that uses custom algorithms to predict when patients are potentially at risk of a decline in their condition and a possible trip back to the emergency room. So care teams can intervene early and help keep patients at home and out of the hospital. The Philips Frail and Elderly program pairs our Lifeline Medical Alert service with CareSage technology to help healthcare organizations keep their frail and elderly populations with chronic conditions at home and as healthy as possible, as long as possible, and manage more patients over a longer period of time, all while helping reduce avoidable admissions and ER visits with the potential to improve outcomes and increase patient satisfaction and loyalty. For example, patients who leave the hospital with a Philips Lifeline Medical Alert service are up to twice as likely to choose the same healthcare system for future care than those who go unmonitored. When managing patient populations, healthcare organizations need solutions for patients as they move between different stages of risk. The Frail and Elderly program, powered by CareSage, is a natural complement to current telehealth programs. But what about those who go off telehealth, or maybe never used it? We know that 25% of Medicare patients will move up to the highest risk segment every year. Our goal is to help healthcare organizations identify which patients would most benefit from monitoring to keep them stable and healthy for as long as possible. The CareSage algorithm model was based on historical user behavior data from thousands of seniors using the Lifeline Medical Alert service. So, we can use data dynamically to see how users interact with the system over time. For example, when and how often they push the help button, if and how often Auto Alert has detected a fall, if they are calling for help or just checking in, as well as the outcome of the call. Combining this data with insights on an individual patient's diagnosis and demographics, we can identify patterns that predict when he or she is at risk for emergency transport in the next 30 days. Healthcare organizations can customize an at-risk status threshold for their specific patient populations, and our dashboard interface will automatically alert care teams to real-time changes in an individual patient's status, so providers can triage these patients, determine the correct interventions, and take action. At the same time, healthcare organizations can view at-risk rankings across the entire patient population, making it easy to see which patients need attention sooner or to prioritize resources. The Frail and Elderly program, powered by CareSage, integrates seamlessly into your workflows and EMR system with minimal IT requirements to start and is designed to scale with your needs over time. Our implementation team is with you every step of the way to deliver a smooth, seamless, and successful integration. Built on the Philips HealthSuite digital platform, the CareSage predictive analytics engine gives healthcare organizations a valuable tool to help reduce risk, lower costs, and improve care, while keeping patients feeling safe and connected across the health continuum. Learn more at www.philipslifeline.com/CareSage. Philips, innovation and you.